Coronavirus infections are spreading rapidly across the South and West. According to Axios, new cases are up 11% nationwide over the past week. In California alone, infections set a new record, exceeding 4,000 in a single day. Meanwhile, Tulsa, Oklahoma, reported its highest number of new cases ahead of President Trump's campaign rally this weekend. Our Laura Podesta has the very latest.
President Trump says he's not concerned about the increasing number of coronavirus cases nationwide.
The flames, they flare up in certain areas a little bit, but I think we'll put them out very quickly, and we won't be closing the country again. We won't have to do that.
The president is holding his first rally in months in Tulsa, Oklahoma, Saturday. The city's health director says between June 6th and 13th, there was a 116% increase in new coronavirus cases. Mayor G.T. Bynum admits he's anxious the rally could continue the spread.
I think any rational person looking at any large grouping of people, which is what we've been telling Tulsans for the last several months, that you need to be concerned about, would have concerns about this weekend.
Former Vice President Joe Biden took aim at the president during a speech in Pennsylvania.
Donald Trump's failure to fight the coronavirus with the same energy and focus that he uses to troll his enemies on Twitter has cost us lives.
President Trump has future rallies planned for Florida, Arizona, and Texas. All three are reporting spikes in COVID-19 cases.
Unless everybody wants us to go back home for another 18 months before we have this vaccine, we've got to get used to doing the right thing when we're out in public.
In Texas, a battle over face masks. After the governor restricted cities from requiring residents to wear masks, some counties are now threatening businesses with fines if customers and employees don't wear them indoors. Laura Podesta, CBS News.
So Florida isn't the only state that's sort of dealing with a battle over face masks. A number of state and local officials are actually reversing their initial decisions and now requiring people to wear face masks. So ER physician and clinical director of Cure Urgent Care, Dr. Jake Deutsch is joining us now. A little reversal there, Jake Deutsch. Doctor, so this is rather interesting. You know, Florida and some other places made it really optional to whether or not you wanted to wear a mask, particularly if you're going to a store or something like that. And in fact, some, authorities kind of downplayed the necessity. And now the conversation is changing. But I'm wondering, is it a little too late at this point to start encouraging people to wear masks?
No, never. I mean, that's what we know works. The simple PPE device of a mask reduces infections. And I can say personally from my practice, when we started having full PPE precautions, not one of the employees, physicians, medical assistants has contracted corona with high incidence of exposure. So, that's incidental, but we know on a much greater level that using masks works. So I don't think it was a great idea to lighten the restrictions, but certainly reversing it is only going to be positive. So we got to keep using them.
Dr. Deutsch, can you do me a favor and debunk a conspiracy theory that I've seen on social media? Specifically, I did a piece this week where in one of the pieces I was showing how to work out in the age of coronavirus, and I was out on my jog and I had my face mask on, and people on Facebook and on social media started saying, my doctor told me that if you work out with a mask, you can hurt yourself because of CO2. I'm guessing, doctor, we're not in the business of speculating here as journalists, but I'm going to speculate that you or your physician surgeon friends never passed out wearing a mask for 10 hours in the operating room. Am I right about that?
Yeah, no, the idea is that air is able to move through, and that's all of the gases, oxygen or carbon dioxide. So, we want to it makes sure that that's clear, that that's not one of the problems. I mean, certainly it's not easy to work out when you're wearing a mask. And if you're in a wide open space, you don't necessarily need to. But in the city, we have a number of people who are jogging in very close proximity. And when you're sweating and you're breathing heavy, there's lots of chance for exposure. So that's where it becomes important to use the mask for that circumstance as well.
Man, I'm glad you cleared that up, because it is sort of a hotly debated thing. Around my neighborhood, there are kind of signs demanding that joggers wear masks, and there are others, saying we don't have to wear masks. So it's become like a bone of contention in our neighborhood.
The hard part is that I was just going to say, the hard part is in the businesses that are opening. That's where we're really going to need to see enforcement. And even in medical practices, I mean, we see people that are walking into the office without wearing masks, and we need to be cognizant that that's very important. And people are observing and commenting, and, we all do our best to make sure that the moment somebody steps into the office, whether it's a medical practice or it's a business, that they're wearing a mask as well. So that level of enforcement is really critical.
Man, is that the case? Because as Vlad already knows, I've been railing about my local bodegas and how even though there's signs on the door that say you must wear a mask, it's like everything has fallen apart over the past few weeks. And even the people who actually work in the stores, if they have their mask on, it's underneath their chin. And I'm wondering, have they not been paying attention? But I don't want to eat up too much time with all of my ranting. So listen, NPR just did a survey of state health departments. The national coronavirus contact tracing workforce has tripled in the last 6 weeks, which is good. They're hiring more people, but only 7 states and the District of Columbia actually have adequate staffing to do proper tracing. This is like, one leg of a three-legged stool when it comes to keeping track and containing the coronavirus. Remind us what contact tracing is and why it is so vital to get a handle on this.
So basically, the tests that are positive are being reported to the state agencies, and the health department is then relaying this information so somebody can reach out to the individual and then determine where they've been, who they've been in contact with, and urge that person to get tested. I can say from experience, we've had those calls coming to our office. We've had positive cases that they're trying to then get in touch with the person who had the positive COVID test and then make that contact. So in New York, we're seeing that happen. I can't comment in terms of what the efficiency is, but certainly that's very positive that we're seeing this start to take place because it's one of the important steps. We need testing. Testing works. Testing is necessary. We've done lots of studying in my practice of 5,000 patients for antibody testing, and we learned that people who were presumed to be positive without a test, doctors were right only about 50% of the time. We have to just keep using these tests. We have to test asymptomatic people because the carrier rates are high. And then when we get these positive results, we need to react. We don't want to just tell people stay home. We need to see where they've been, what they've been up to, who they've been in contact with. And we need to get this idea that testing is something that needs to continue on a very regular basis.
Real quick, doctor, before we let you go, after months of handling emergencies, dental offices across the U.S. are beginning to reopen for some routine care like teeth cleanings and cavity fillings, but dentistry is considered one of the highest risk professions for the coronavirus. I know that in my dental office, they all wear masks, they all wear gloves, but what kind of a challenge does that pose, I guess, both for dentists and for patients?
Yeah, I've seen a number of patients who are coming in trying to get COVID testing before they can go to their dentist. So that's one of the steps that are taking place in order to eliminate exposure. But again, PPE works. It's working in the hospitals. It should work for dentists. So using a mask, using gloves, making sure that they're washing hands frequently, and then screening patients is going to be essential. But like any other exposure, whether it's a hospital exposure, whether it's on the street, whether it's in a store, there is risk that's going to be associated with opening up again. But I think that dentists have very good knowledge on how to protect themselves. And we've seen dentists starting to use masks and face shields years before COVID because they were in such high exposure. So I feel confident that they're going to be able to do this, but it's very important that everybody follows the same protocols and that we screen people carefully. And people need to be responsible. I mean, knowing your status is a thing with COVID, making sure that you have your COVID testing, maybe getting antibody testing to see if you've had it before, and then frequently retesting is going to be part of that process, and that knowing your status is going to apply to dental visits very much.
All right, Dr. Deutsch, thank you so much as always. We appreciate it.
My pleasure. Take care.